Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Dumping syndrome. Dumping syndrome is a group of postprandial symptoms which mainly occur because of the gastrectomy. So here these are the postprandial symptoms which occur due to increased emptying of the stomach contents from the stomach into the intestine. So whenever there is premature, that is even before, actually once we eat the food reaches the stomach and from there it goes into the intestine, but the pyloric sphincter is initially closed so that the food is churned in the stomach and it is partially digested. Okay, but in dumping syndrome, because of the gastrectomy which has occurred, this pyloric sphincter will be removed, and as a result the food which has entered the stomach will empty into the duodenum faster than usual. As a result, the hyperosmolar stomach contents enter into the small bowel. In this condition, then here mainly it is seen in conditions who has undergone the it is seen in conditions who have in patients who have undergone gastrectomy, antrectomy, and in drainage procedures. It also affects sometimes patients with high vagotomy, highly selective vagotomy might also suffer with this dumping syndrome. Then this is dumping syndrome.
thank you and thank you for watching.